Hi, I'm Grace. I'm a 4th semester nursing student, and I will be demonstrating the skill today of inserting an NG tube into my patient. Before I begin, I want to ensure that my patient does not have a history of any nasal surgery, no deviated septum, an intact gag reflex, and a doctor's order for this procedure. In addition, I will want to ensure that their mental status allows for cooperation. Okay, so I'll introduce myself. Hi, Mr. Jones. I'm Grace. I'm going to be your nursing student today. I will be inserting an NG tube, and it is to empty the contents of your stomach. I will make sure that he's in high Fowler's, elevated bed, privacy is provided, and I will perform hand hygiene and don a pair of clean gloves. And before I begin inserting the tube, I will want to check the patency of his nares using a pen light and occluding one nostril at a time to ensure adequate airflow. So we'll say that the right nostril is the one that I would like to use today. Make sure there's a towel over the chest and some water close by. Next, I will measure my tube. And I will measure from the tip of the nose to the back of the ear down to the xiphoid process. And then with my prepared tape, I will mark that spot on the tube. I will make sure that my patient's head is tilted back as I begin to insert the tube. And if I met significant resistance, I would withdraw the tube, lubricate it, and insert in the other nostril. We'll say that I'm meeting no resistance here. And once I reach the back of the oral pharynx, I will rotate the tube 180 degrees, ensure that it is not coiling in the back of the mouth, and begin instructing my patient to take sips of water as I continue putting the tube inside. For each swallow, I will insert the tube another 2 to 4 inches until it has reached my tape mark. On this mannequin, I can't insert it up until the tape mark, so we will say that this is the correct distance. Keeping this tube clamped, I will take a piece of tape and secure the tube to my patient's cheek while I ensure for proper positioning. And I can check one of 3 ways. Golden standard is an X-ray for positioning. What we'll do today is a bolus of air, about 30 milliliters of air into the tube. While I listen for a swooshing sound to ensure that the tube is in the correct position. Next, I could aspirate some stomach fluid and use pH papers to ensure the pH is less than 5. Assuming that we have the correct placement today, I will now secure my tube in place. So if he was oily, I would want to wipe this off before I put tape on it so that it would stick. But I'll just wrap this around, make sure it's not pulling too tight, keep it in place. And then I can also wrap a piece of tape around it. And pin it to his hospital gown. Let's see. Next, I will make sure this is clamped or stopped off in some way. If it was attached to suction, this is where we would have that attached. For the sake of the video today, I won't be doing that. But I would want to document that I completed this procedure, the patient tolerance, any aspirated contents that I got, the pH of that, and the appearance, and whether the patient had any issues with the procedure, whether they went cyanotic, whether they started coughing too much, or anything like that. Then I would ensure the patient was comfortable, place the call light within reach, and perform hand hygiene.